So, a warm welcome. Hi there, everybody. A warm welcome to everybody joining us from all over the world for today's ISNTD Connect. Today's Connect is a very special because it's coinciding with World Rabies Day. We've entered a very important decade, which is the last decade before the 2030 targets, these zero rabies targets. And so we expect to see a lot of activity in the run-up to 2030. Whether that activity is going to address the barriers that are holding back rabies control, whether it's going to engage with the communities in terms of rabies control, whatever shape it's going to take, it's definitely going to be affected by the current COVID situation. So it'll be interesting to unpack some of that during this particular session. I'm delighted to have our two speakers here with me. There's Dr. Waqas Ahmad, the Assistant Professor of Epidemiology at the University of Veterinary and Animal Sciences at the Narowal campus in Pakistan. Hello there, Dr. Ahmad. Good to see you there.
Thank you.
Hi there. And also joining us from Dorset, it's the Director of Strategic Partnerships for Mission Rabies, Frederick Lohr. Hi there, Frederick.
Hi, everyone.
Brilliant. I think without further ado, I think we'll pass to discuss in terms of looking at those barriers from the perspective of a country that has endemic rabies, and your effort could do with some augmentation, some strength, calls for partnerships, that type of thing. So it'd be very interesting to hear what you have to say, and following that will be Frederick. So I think without further ado, I'll just pass the floor over to Dr. Ahmad. So thank you very much. A round of applause. Yeah, and I'm just going to mute myself.
Yeah, thank you, Kamran, for the nice introduction. I'm going to share my presentation with you. Okay. So good morning, good evening, wherever you are, and thank you, Kamran, for introducing me. So today I'm going to talk about the global elimination of rabies by 2030, and
because I think
there are certain.
Your sound. I think you have to put your sound back on.
Hello, can you hear me? Is it okay?
Dr. Waqas, we can't hear you. We can't hear you. Is your sound
Hello?
on?
No, the sound is okay.
Fine.
It is okay now?
Yeah, it's fine. It's fine. It's just a little glitch at the beginning. It's fine. That's perfect. Thank you. Over to you. Sorry. Yeah.
Thank you. So rabies zero by 2030, will it become a dream come true? You know, a lot of neglected tropical diseases we are just discussing, and there are malaria and tuberculosis. We have also the elimination strategy by the end of 2030. But there are certain, major problems. There are certain barriers which are quite common in the developing states of Asian and African region, which are quite abundant, which are quite prevailing day by day, and we need to focus on those barriers. So I will discuss in detail, but with a little emphasis on those barriers, that what are those barriers and how we should look into those, keeping in concern with the individual perspective. So briefly about the introduction, the rabies virus is a cunning virus. You know, it hijacks the cellular machinery, the TLR3 receptors through evasive strategies. It is the oldest recorded infection of mankind. The word rabies is also renowned to be abbreviated and originated from Sanskrit word, which means to do violence. And there is a lot of peculiar history associated with the rabies before the invention of vaccine by the Pasteur, and it causes the highest recorded death rates throughout the world. More than 100 countries which are being infected by this disease. And if I would like to describe this disease in developing states, I would use these three words to describe it. I would describe it as it is a persistent, neglected, and underestimated viral disease in Asian and African states, because most of the resources and most of the resources which are being spent on other diseases, but the neglected tropical diseases, they are always abandoned. So just like other entities, rabies is also abandoned and neglected tropical diseases. So dog is the principal reservoir for more than 95% of the cases. And it is also multiple species infection referred by the OIE, and many countries show absence of data. If we go towards the data repository at the WHO and OIE forum, we see a lot of countries who are showing the absence of data, and there are very few countries who are on their path towards rabies elimination. They have started to gather up the dog population census and the human rabies deaths, and they have started to compile up data, but most of the countries, they haven't any data to show up to be submitted for the WHO and OIE. And the WHO and these OIE and FAO and the GORP, they have launched a very good commitment, and that commitment is a kind of driving force which is moving all the developing states and all the health sectors, all the government sectors in many developing states, and these tripatriates is a very good motivational force. And I must appreciate that recently they have also launched the United Against Rabies forum, and they have also showcased a very good webinar, and they have also stressed upon the implementation of One Health approach for the elimination of this disease. So educate, vaccinate, and eliminate is also a very good strategy. And for the current year, the Global Alliance for Rabies Control have stressed upon the collaboration and vaccination approach, that they are fostering this approach to be adopted by the governments and the stakeholders and other agencies for the implementation, especially in the developing states. And those major barriers are still out there, despite the data repository has been launched by the WHO. And those barriers are the multifactorial, they are persistent and posing major obstacles and problems. And those problems, the intensity, the extent, and the quality, and the you can say the amount of a problem varies from country to country. For example, if we look at the situation of Pakistan, a lot of barriers they are contributing towards the occasional death of rabies and dog bites. And the situation is quite similar in our adjacent countries like India, Nepal, and Bangladesh. But those countries, they have moved towards some sort of elimination strategies at national level. So most of the countries have common issues, and the disease is also regarded as a disease of poor people, and stands bold in developing countries of the world. And if we compare the developed states, the European region, they have eradicated this disease through efficient surveillance and control strategies. First of all is the prophylactic measures, and if we look at the various publications, and if we just Google around the prophylactic measures in India, Pakistan, Nepal, Bangladesh, and some sort of African states, and if we also analyze the knowledge, attitude, and practice, the CAP surveys of those countries, we see that most of the people, they are not complying to the prophylactic measures. They are not adopting those prophylactic measures. And the reason could be they are either unaware of those prophylactic vaccination measures, and the other could be the perceptions. And the other problem is the access, procurement, and distribution and availability varies from country to country. And the shortage in public health facilities is also another problem, that most of the government facilities, they are not providing these facilities, and they also recommend to go to the private practitioners to get these vaccination shots. Demand and supply gap is also another problem, and most of the countries, they also have a high demand for the vaccination, but the demand is quite low and the supply is also quite low. And some countries, they have also generated and starting to produce in their own country, and this is also a very good option to meet up the demand and supply gap. The cost and subsidy issue is also another problem, which is being seen in the government facilities, the government hospitals of various countries. The cost of immunoglobulins is also another issue. The immunoglobulins, those are expensive, and the hospitals, the basic health units, they do not usually keep those immunoglobulins. The other is the most important is the ecological studies and the increasing population of dogs. We have recently seen that 8.6 billion US dollars are being expensed for the vaccination purposes, and more than 400 million dogs are ownerless. Almost 10 million dogs are annually culled, and there are very brutal and very notorious method of culling. And those methods, we all know that those are not being contributing in the elimination of rabies, but those methods are being adopted by the local health authorities, and the global elimination of the rabies mission is quite low. Being if we just look around the culling methods, 10 million dogs are annually culled. But these stats, we can say these are not the true estimates. It is because that most of the studies, most of the work, which are being governed by the dog welfare societies, the animal welfare societies. So they are summing up the data, and the recently stats show that the 10 million dogs are annually culled. But I think there could be more than 10 million dogs. The transboundary traffic of dogs is also another problem. Issues of African and Asian states. So most of the elimination strategies have been implemented effectively in the European states, but a few of the Asian states and African states, they have also moved up towards the elimination program, but yet there are these problems which are being faced in some of the territorial regions of these countries. Thousands of dog bite injuries in all age groups have been reported in various countries. And some other countries, they have evaluated the dog bites to human ratio, but yet some of the countries, they are not quite sure about these ratios. And the unknown stats of dog bites to human in many states, and the complex ecological interaction with the dogs is also not well interpreted. Dog population and density studies need to be implemented in Asian and African states in order to calculate the MDB programs. Ecological studies of dog species and niches, dog animal welfare trust and societies need to be taken on board to conduct these studies, and the role of veterinarians is also very important. So we have to learn the management and handling of dogs and animals. This is the most important aspect. We may say that it is the fundamental aspect in controlling the rabies throughout the world. We are saying that this is not the problem of stray or unknown dogs. The dog bites is also a problem of pet dogs. In fact, most of the publications, they also show that in European regions, in the Americas, that most of the dog bites, they are coming from the pet dogs. The dog interactions to other animals, we need to understand these features, that how dog behaves towards other animals, because in our developing states, most of the free roaming animals, they used to interact with each other in the pasture. Human behavior and attitude and interaction, it also varies from country to country, and includes different cultural and ethnic perspective. And ownerless dogs versus pet dog, there are two different domains. We need to understand that how ownerless dogs behaves versus pet dogs. We can avoid dog bites through a knowledge of these factors. And household waste is also another problem that of the developing states, that we used to put a lot of waste on the roads and streets in various countries, and the household waste management is not being practiced in those countries, and the recycling mechanism is also not efficient. So those waste of household attract dogs, and those dogs ultimately bite to the passengers. Responsible pet ownership is really important, that we should take care of their food, health, and welfare ethics. So this is really interesting diagram to interpret the total dog population. That we have two categories of dog. One is the confined and the roaming dogs. We can say that the unknown dogs, the free roaming dogs, can be converted to the owned dogs. But we can say that we can also say that the owned dogs can be converted to the unknown dogs. So this is also a problem, because some of the owned dogs, they are not being well supervised by the dog owners, and they are also contributing to unwanted reproduction in the environment. So the ecosystem has to be well managed. If we have to well manage the dog population, we have to move these unowned dogs towards the other side. Like we have to move the unknown dogs towards the owned dogs. So this could happen just because of responsible pet ownership through well-educated awareness programs, seminars, and workshops. So the people can have a very good idea that how they can keep their dog free from disease, and how they can also play their roles in avoiding dog bites. Public awareness is also much important. I have highlighted a very good presentation of one of my students group. They are doing awareness activities in various schools. So they have submitted this presentation, and it has been accepted for the oral presentation in RITA conference. And the GORC and the other World Rabies Day sources like that, they are also doing wonderful jobs. But there are also superstitions and the cultural behaviors, religious norms, demographical features, which are posing barriers in elimination programs. Like the people, they might think that the vaccination is not yet very fruitful in elimination of rabies. The people might think that the vaccination need a lot of money, and they don't need to put a lot of money and efforts towards the vaccination. They can take care of their dogs by their own. And there are also, studies that most of the Muslim populations, and if we look around the publication, if we look around the stats, they don't want to keep dog as pets in Muslim population, but most of the other ethnic groups and other religious nations, they used to keep dogs. So the barriers and the ratio of the dog bites varies from population to population, and they are also quite linked with the religious values, the cultural values, and ethnic or demographical norms and values. But the ultimate aim is that we have to understand the humane management of dogs, how we can take good care of dogs, keeping in concern with the responsible pet ownership. Poor perceptions of health workers include the doctors and the veterinarians. That a lot of CAP surveys, which are being practices in Asian and African states, they used to estimate the risk factors which are being prevailed in the medical health practitioners. And the problem is also among the veterinarians. Most of the veterinarians, they might not have a very good idea of the rabies preventive measures, what are the requirements and the schedule of prophylactic measures, how they can advise a very good piece of advice to their patients, falling under the veterinary client-patient relationship. And the lack of motivation and the patient counseling is also another factor. Governments need to take major steps if they really want to be into this program, and if they really want to eliminate this disease, because legislative steps and the ordinance need to be taken into account. It is because the Mission Rabies is not a one-man job, or it's not an organizational job. It needs a collaborative effort, a One Health approach for the elimination. Large-scale mass dog vaccination need huge budget assessments and national planning, and need the prioritization of the different sectors at national level. A lack of even category-wise budget and practical interventions are needed. The countries may need categorical emphasis, like in Nepal. Today I was listening to the presentation. They have prioritized the risk areas, and they have started the mass dog vaccination in that area, and then they have started to other areas. So if we have a very good surveillance, we can calculate the incidence and prevalence at that area, and we can start our efforts and we can put our resources at that specific area in a specific country. So the problem is also that we have to enable the politicians and the government officials to understand the importance of mass dog vaccination. This is quite a challenging job that how you can convince those politicians to release the budgets for the mass dog vaccination programs. The higher cost of prophylaxis and vaccination campaigns need the government participation. Diagnostics and surveillance is really important. If we are just have just diagnostics and we are not carrying the surveillance parameter with the diagnostics, then a diagnostic is not good enough. So diagnostics need to be combined with the surveillance so that effective reporting and notification mechanism can be established. The improved diagnostic surveillance is deficient in most of the developing countries, and the contact tracing and associated reporting method is also not available. The results in underestimated data of rabies deaths and dog bites are also not well reported, and the fragile methods of sampling and transportation is also another problem which are being faced in the developing states because of the temperature and the climate conditions. Epidemiological investigations, the epidemiological data, the global burden of rabies is quite underestimated due to unavailable stats regarding the dog bites, the human deaths, the animal deaths due to rabies, and the submission of data from individual territory of a country to OIE need sophisticated surveillance tool and coordination like this. And the calculation of the dog bites and the calculation of the notification, the total number of deaths move from the local health authorities, and then they move to the national health authorities, and ultimately towards the OIE for the final notification. But if we do not have the regional or the national or provincial bodies to calculate these data sets, then we cannot estimate the true burden of rabies. The lack of laboratory setups and animal population census and modeling studies is also another problem. But few of the agencies and few of the investigations which are being governed by the European universities, they used to fund students for the epidemiological studies in most of the African states. So that is a very good option to understand, to envisage the control strategies, to understand that what kind of preventive measures would be best suited for that specific country. It is all because first we have to we have to investigate the mechanism through the modeling and epidemiological studies. And most of the surveys, they have to be conducted in these developing states. One health approach, definitely we need to put our hands together regardless of our profession. We need to put our efforts by combining the veterinary, medical, and the eco-health system into one approach so that we can combine up our efforts to move towards the sustainable developmental goals of the United Nations. But the problem is how to evolve into One Health. It is also another problem that we are discussing, that we should move towards the One Health approach. But how to move, how to evolve ourselves into One Health approach is also another problem. So the training and the motivation and the mitigation strategies are needed to be implemented on different professionals, especially on the medical and veterinary profession, that how they can involve their profession into One Health approach to collaborate with other health professionals for the elimination of rabies. Cross-cutting interactions are absent in this country, putting table discussions into practical approach of implementation through division of labor. If we discuss the problems in the developing states, then we have to make a strategy. We have to segregate our duties into different collaborative approach, so that they can contribute their approach, and so that they can also contribute their role in the elimination programs. But if we just discuss those issues and we do not have a very practical approach, we do not have budget assessments, then those discussions are, I think, not so much important to be considered, because the discussion and the table talks are needed to be needed to put into the practical approaches. So I would conclude this presentation that the socio-culture, technical and organizational resources is not being properly implemented, which is a straw power phenomena, that there are different aspects of rabies which are linked towards socio-culture, technical, organizational, political or resources based. So all of these aspects need to be combined. They need to be operationalized in developing states in order to eliminate the global elimination of rabies. And the surveillance strategies offered by the various tools like stepwise approach towards rabies elimination, and the web-based programs launched by the Rabies Epidemiological Bulletin is also very much important to trace the MDV programs in the countries. So we need to put our efforts in order to focus on these barriers, that these are really important to be eliminated. If we are we have a collaborative One Health approach to solve these major problems, and it would be a very good way towards our path towards the global elimination of rabies by 2030. So at the end, I would acknowledge, I would also like to thank the ISNTD network team for giving me the chance to present my ideas and thoughts regarding the global elimination of rabies. And also the GORG team for putting up my work at the social media platforms, and my colleague, Dr. S. Naeem, for helping me to compile up this presentation, and my principal, Professor Dr. Muhammad Yunus, for encouraging me to present at this seminar. Thank you very much.
Thank you very much, Dr. Ahmad. Wonderful presentation. Such a reality check, I think, to hear all of the various barriers, from data to vaccination to responsible pet ownership, even though what's obviously needed is a mass dog vaccination program. There was a part in your presentation where you said there's not even a category-wise budget for this. So that is such a reality check to hear that, and then you kind of recalibrate what you can actually do in terms of what are you left with if you can't get the vaccine out on a mass dog vaccination program. It's going to come down to the educational and awareness and integration of the people who are the communities around these dogs. Fascinating presentation. Thank you very much for that. And I think,
thank you.
Obviously, that's what. Thank you, and that's obviously the Pakistani perspective. But I'm sure there's a lot of touch points and a lot of resonance with some of the attendees that are here. So I'm just going to quick shout out. So there's Dr. Francis Ingolet Olaki from the Public Health Veterinarian from the District Local Government in Uganda, who's tuned in. Stephen Bramia from Canada has tuned in. We've got Dr. Ivana Huskova from France, Dr. Raj Chowdhury from Lohr from the Health Research ICARE, the Ebman Center for Food and Health Research in Nigeria. A big shout out from Ghana to Bashiruddin Kofi Menza. Also Semu Adeni from the Noma Children's Hospital in Nigeria. We've got quite a a selection of people. I'm just thinking Dr. Majid Harandi from Iran. Very interesting presentation. I think it's going to, a lot of questions have already started coming through, and we'll just wait until the next presentation is finished to go on to that. So thank you very much for that, Dr. Hussain. I'm just going to mute you and bring on Frederick, if that's okay. So
okay.
I'm just going to, yeah. So Frederick, if you could bring yourself back in. Yeah, here comes Frederick.
All
there
right.
we go.
Can you guys hear me?
Yeah, yeah, we
Awesome.
got you. So we heard there from Dr. Ahmad, really, the kind of on-the-ground situation, the reality faced by a country like Pakistan in terms of the barriers that they're trying to overcome to reach this zero human deaths by dog-mediated rabies. So it'd be very interesting to know and see how an NGO in this space, I know that the Mission Rabies have worked extensively across Africa, Malawi as an example, how they're looking to engage in this decade leading up to those zero goals in 2030. And very interestingly as well, I'm sure it'd be be interesting to get a look. It's inescapable, the impact of the COVID-19 situation on some of the activities, disease surveillance activities, or perhaps even from an NGO's perspective, their own activities in this space. So it'll be very interesting to find that out. I think that's enough from me, and I'm going to just back out. So round of applause, and yeah, let me just stop. And over to you, Frederick. Thanks a lot.
Alrighty, thank you very much. I hope this works now. Awesome. Well, thank you very much, guys, for having me. It's been an honor to be invited to give this presentation. So my name is Frederick Lohr, Dr. Frederick Lohr. I am the Director of Strategic Partnerships at Mission Rabies. And today I'm going to give you basically a twofold presentation. One is to address the challenging situation that we're currently living through with the COVID-19 pandemic, and then what it means for rabies control and how we as an organization together with our partners have coped with this. And then as a second part of my presentation, I'm also going to speak about how we can get more people behind this. How can we get the global community all rallied up to help to reach this 2030 goal? Just really quick, first of all, I just want to give you a quick overview who we are as Mission Rabies. We're an NGO based in the UK, but we have offices basically all over the world. And we work to create an efficient, systematic, economic, transparent and scalable approach to rabies control. So this is what we're all about. And we do this through canine mass vaccination, rabies education, what Dr. Ahmad highlighted as well is so important. And then of course, also through rabies surveillance. We do this by really putting the theory into practice. So we talk a lot about all the different systems that are there. We talk a lot about what we have to do, but not many people do it. So this is what we're all about. We really take that theory, put it into practice, refine it, and then also document this success and help these programs to then eventually scale up and get where we need to be on a national scale, really. Mission Rabies, together with its partners, developed a huge toolbox of all different tools that we need for rabies control that are simple, intuitive, and also practical. So this is what it's all about. We really want to make this as easy as humanly possible. Now, today, I'm not going to speak about these tools in detail, but I just wanted to mention them at this point as well. And if there's any interest further down the road, always feel free to just ping me a message, send me an email, and we can discuss in more detail. But basically, we have created a complete system that enables rabies control program managers to manage teams, to track the progress, to check whether teams have been through a path tracker. Every single dog is logged, everything is put together in one single platform, and yeah, basically presents the entire suite that you need for rabies control. And this is all freely accessible to governments, academic institutions, and other NGOs. So this is really yeah, at the core of what we're doing is documenting what we're doing and really learning from every single bit and every step along the way. So what you saw there is the WVS application, which is a data collection platform, but so much more than that as well, because as I said, you can control teams, so it has a built-in GIS platform as well. You can geofence areas for teams to visit, and you can also track their paths through these areas to really ensure that the work is being done in the right way. It helps to facilitate surveys, and this is really all to, as Dr. Ahmad highlighted, to address that gap, bridge that gap in the lack of epidemiological field data and practical examples. We really want to show everyone how it's done and you can do this. And we're really taking everyone by the hand and walk them through and really help them to achieve this themselves. Another thing that Dr. Ahmad highlighted in his presentation as well was the lack of surveillance data and the lack of tracing, the contact tracing and the reporting of dog bite cases. And for that, we have also worked to create a system, the so-called REACT app, that really brings all of this again together in one system and helps to facilitate integrated bite case management, which is currently like the gold standard in rabies surveillance. But enough of the tools at this point. Just really quickly, the sites where we work. We have two major flagship projects, one in Goa in India, the other one in southern Malawi. And then we run several what we call proof of concept projects in Africa and in Asia as well, where we vaccinate a number of dogs in a distinct area and really can trial new techniques and, as I said earlier, document this progress and really learn from this as well, whilst at the same time really help to stimulate rabies control in these places. Then, of course, earlier this year, this happened. So up to date, we vaccinated over 1.3 million dogs in these places since we started in 2013. But then, yeah, earlier this year, this happened. And yeah, put the entire world, as we're all painfully aware, at basically a grinding halt for a particular amount of time. But further down the line, it was clearer and clearer that yes, COVID is serious and we have to do everything, but we cannot forget the other infectious diseases as well, and amongst them rabies. And in some countries, like in India, we also had people calling for the stray dog to take care of the stray dogs. And so there's so many more issues linked to this. And WHO released an interim guidance for NTD programs really early on in April already, which also stipulated that rabies control as a public health intervention is essential, and that included dog mass vaccination. So what we did is we started reaching out to our local partners, the local authorities, and really started early on to work in close collaboration to be at the forefront of this and be compliant with all the different measures that are in place to really get the programs up and running again. Of course, everything has to be done in compliance with local restrictions. In a lot of places, veterinary services and mass dog vaccination falls in most places under veterinary public health, have been deemed as essential. So our teams were able, together with the local guidance for PPE, as you can see in this personal protective equipment in this picture, to put together a plan on how we can, with the local restrictions in place and with the extra permits, get it all starting again. So as a first step, we of course suspended all non-vital and non-essential work that we do, like for instance, dog ecology surveys, everything that is not vital to the absolute operation of the vaccination program has been suspended so far. And we do work with a absolute reduction of direct contact. So we try to avoid our teams getting in touch with the local population as much as humanly possible for the purpose of the work. And that, of course, means that we also need to focus on the most effective vaccination method in that particular area. And as you may know, depending on the local dog population, how it's composed, and that's why dog ecology studies, for instance, are quite important as well. There are different ways of going about this. If you have a large free roaming population, for instance, you would focus more on catching that free roaming dog population. Whereas if you have a predominantly owned population, then you really have to focus on that. And I'll show you two examples now on how we adapted both of those methods for a COVID setting. So for instance, in Goa, and you see these two pictures here, these have been taken in the last two months, our project. As you can see here, our teams maintain, where it's not otherwise possible, maintain the largest possible distance between the dog owner and the team member. And at the same time, where personal protective equipment, in this case, even double protection with a face mask and a face shield. And where it's possible as well, we try, as I said earlier, we try to avoid the direct contact, and it's all down to our team to restrain the dog. And as you can see in this example, it's that's fairly straightforward. At the same time, in Malawi, it's slightly different. We have a predominantly owned population. And here we adopted strict social distancing measures. As you can see here, everything is spaced out. The groups of people that you see together here, for instance, and here, that's all the same household. We also made sure that we have marshals patrolling the area. They are also, as you can see in this picture, they wear face masks, and they make sure that social distancing is adhered to. And again, here in this picture, you see it quite well as well. At least 1.5 to 2 meters distance between everyone, and we had notifications on there as well. Well, apologies, the animation is shot here. We also, because these are static point vaccination clinics, we also set up hand washing stations. These are all operable by foot, so you just have a pedal, you step on it. So that everyone entering the queues can wash their hands first. And again, as you can see there's one of our crew members next to it to ensure that everyone uses their hand washing station. And again, every member PPE. So this is through these measures, we actually managed to vaccinate more than 37,000 dogs in just under 10 days in the city of Blantyre in Malawi. And even in Goa, we also continue our work and vaccinate all of these animals to ensure that we have that 70% coverage that we really need for rabies control. Now, today is World Rabies Day, and I also wanted to use this opportunity to introduce a new campaign of ours that I really happy to present to you today. One of the things that Dr. Ahmad highlighted as well is just general awareness, and it's a collaborative effort. It's something everyone, whether you're in the global north or global south, needs to get involved into to actually reach this 2030 goal that was set by WHO, FAO, and OIE. So what we came up with is a campaign called the Final Rabies Generation. We're now in 2020. That's 10 years till the 2030 goal. We really need to crack this in the next 10 years to make all of these kids that you see there the last and the final rabies generation. So the campaign is really set to be a global campaign to highlight this goal, to get everyone engaged. And also, which is a different spin to it, we want to keep this positive. We can do this. We have these examples. in all of our project areas, in Malawi, in India, we saw a decline in human rabies deaths due to canine mass vaccination. So this is something really positive. We can do this. We just need to all pull together. And this is really what we want to focus on. It is a vicious disease, but we can beat this. It's inspirational because we want to use these examples again and then see that as a stimulus to really get everyone involved in rabies control and hopefully inspire other countries as well to take this up in a similar fashion. And it's a rallying call to action. So this is really to wake up everyone, get out there, get engaged, go on this journey and really help, no matter where you are, to achieve this goal. So what I want to do now is I want to show you a quick video that we've put together to really explain this a bit better and really get you up and get you involved and get you on board and help us to create the final rabies generation.
Hello there. That should have been playing.
Yeah,
right? It's not playing.
Is it not playing?
Do you launch it from the videos tab?
Yeah, I did.
Yeah. Okay. Let me mute your own microphone for a second. Let me press that. Yeah.
When was the last time you talked about the world's deadliest disease? A disease so dangerous that even when symptoms first start to show, it's already too late. Death is inevitable. A disease that kills a child every 9 minutes, many of whom live in some of the poorest and most isolated communities in the world. A disease that leads to agony, persecution, and death for hundreds of thousands of dogs worldwide. This disease is rabies, and it's one of only a handful of neglected tropical diseases as categorized by the World Health Organization. So amidst all this pain, suffering and death, rabies remains neglected and the world stays silent. But here's the thing. Rabies can be defeated. We have the solution and a pledge from the World Health Organization to eliminate human rabies deaths by 2030. We simply need the world to be aware that this is something we can achieve, and we can achieve it together. If we act now, our generation can be the one to eliminate rabies for good. So by the time children like this have families of their own, they can have hope for the future. If we act now, the countless thousands of dogs that die from rabies each year or are harmed as a result of fear from this terrible disease can lead safe and happy lives as part of our communities. If we act now, these children and millions more around the world can be the final rabies generation. Donate today, and together we can make this the final rabies generation.
Brilliant.
Awesome.
Hello
Thank
there.
you.
Thank you for that.
So yeah, just
problem.
really,
Very powerful.
just really quick.
Yeah.
If you so if you have any further questions, just feel free to always drop me an email and go to finalrabiesgeneration.org to learn more how you can get involved, how to spread the word, and just help us to create this final rabies generation. Thank you.
Thank you very much, Frederick, for that. A very powerful ending. I thought that was, we're getting people coming onto the chat saying, wonderful video, spectacular. That's from Cesar Gavidia. And that was a fantastically positive and engaging start to this this campaign that you got an end to your presentation. I think what's very interesting is a lot of what you spoke about spoke to and addressed a lot of the barriers and gaps that Dr. Ahmad had himself highlighted in his presentation. For a second, 3 years ago, we gave an award, a recognition award, to Mission Rabies for that particular app, the first app, for its disease surveillance and just the way it was set up. And it was wonderful. And I think Marianne has just sent over the link on the chat room to the video of Fred presenting that. I think it was 3 or 4 years ago from our festival. We haven't forgotten. And it's wonderful. And I do urge you all to kind of get involved with that. Dr. Ahmad, could we bring you back in for the Q&A, perhaps? Dr. Ahmad, are you there?
Can you hear me?
We can hear you.
Yes.
Yeah, we can see you as well.
Yeah.
Brilliant. So you're getting a lot of feedback for that video, actually. Helena Oleartha from Jakarta, inspiring and excellent, Dr. Frederick Lohr.
A wonderful video. Like, it started with an emotional start and then went towards the final message. Wonderful video.
I have to, at this point, sorry, I just have to say I didn't create that video, so that is all kudos to our team here in the office putting all of this together. So I can't take all of that praise.
We were just saying that a lot of the presentation, the Frederick's presentation, was looking almost as if it was answering or in answer to some of your issues in terms of the barriers, the educational awareness, the citizen science, the engaging. Fascinating. I think you guys should sit down and talk. So, I mean, I've got a load of questions here, but there's a lot of questions coming through from the audience. Would you be okay if we just went straight to the Q&A? Are you okay with that?
Yeah, absolutely.
Yes.
Yep, perfect. So, firstly, a lot of people saying excellent presentation, both of you, fantastic session. So, I'm just going to start with the questions in no particular order. I'll try and clump them together, but in no particular order. So Stephen Ramia from Canada, vector control specialist, a consultant in vector control. I think he's asking a question around the disease reservoirs. So he's saying that which other organisms, animals, harbor the remaining 5% of the organisms that cause the disease? So what are the other disease reservoirs? Perhaps ask Dr. Ahmad first.
Yeah. There are a lot of reservoirs, like but the most important is the dog. But if we consider other reservoirs that include pets, jackals, foxes, and other wild animals, raccoons, so those reservoirs, they are also posing great threats. But the dog is the principal animal, the faithful animal, and the association, the attraction of humans with the dog is very much important, and it's very much bold. So that is why we have to putting our efforts towards the mass dog vaccination to vaccinate almost 70% of the dogs in order to break the transmission of rabies virus. So yes, there are other reservoirs, but the most important one is the dog.
And thank you for that. Frederick, in your travels, yeah, the same. Obviously, it's the dog, but outside of the raccoons and the civets, and where else have you seen?
Yeah, no, absolutely. So basically, every mammal is susceptible to the virus. So every mammal can get it. I've yet to see a rabid whale or dolphin, but pretty much every mammal. As Dr. Ahmad said as well, bats would be the other species to highlight in this context, and it slightly varies depending on where you go. So, for instance, in Latin America, vampire bats do play an important role as well, but globally in the rabies hotspots, which Africa and Asia, and especially India, dogs are the main reservoir. Between 95 and 99% of all human cases are due to dog bites. So, yeah, definitely.
Yeah, fantastic. I'm really glad you mentioned vampire bats, because we actually have a question on vampire bats later on in this questions thread. I'll come to that, by Paul Ho. He's asked a question regarding vampire bats. We'll come to that. So dogs obviously are the main issue. Mass dog vaccination programs, the holy grail. Given lack of budgets, lack of resource, the reality, these are NTDs. It's a part of the NTD spectrum, diseases of poverty. So obviously, that's really not going to happen on the scale it needs to happen straight away. I'm asking that because Dr. Ivana Haluskova, the infectious diseases consultant based in France, has worked out in India as well. She's made a point. She's saying, is it truly, what's your opinion, is it truly a problem of poor people in terms of lack of education, given the fact that, let's say, India, as an example, is a holder of a vaccine that is largely accessible? They have the vaccine, it's accessible, access is not really an issue, but they still have a huge problem. So I suppose what she's asking there is, she's basically centered the issue around lack of education. So I push that back to you. I can see, obviously, Frederick, you're doing all of the you're doing a lot of that education in your launch. Dr. Ahmad, you mentioned this in terms of educating towards responsible pet ownership and the potential impact it could have. You also mentioned part of your group, the RITA conference that's coming up, looking at assessing impact from a primary school setting, an awareness campaign, and looking at the impact of that. So the question is, how important is this lack of education and the need to address it? Dr. Ahmad.
Yeah, I think it's a really a very good point to address the importance of education at primary school. So you know that the World Rabies Day, the online courses at the GORT website, and the on-site educational sources, and the demonstration, how to behave and how to interact in front of a stray dog or towards stray dog is really important. So what my team, the university students, they are doing, they just make a group of students and they went to different schools and they demonstrated the basic, the fundamental aspects, how to behave towards a stray dog. If a dog approaches towards you, how you should behave, and what are the basic preventive measures. So you know that these are the basic pillars. So these are the superficial things where the problem is going to start. So if you have control over these issues, if you have control over the behavior and the human to dog interaction, then you can control the chain of whole problem that is going to start just from the dog bite. So in order to reduce the dog bites, in order to minimize the dog bites, it is really important to start the educational programs. And I think, and I have read in many publications that in African states they have included the educational resources regarding rabies in their curriculum, in their books. So they have also designed up some storybooks for the children. So it is really important to address those issues at the primary level. Those primary levels include the schools and the early age of the children, where more than 40% of the cases are in children.
Yeah. I suppose you then have the added advantage that you can, from that cohort of children that are being educated, you have tomorrow's champions and advocates for any citizen science input or engagement moving forward. So absolutely vital. And that'd be interesting to see the impacts of that in that presentation in Rita. I think that'd be very good. I've got another question coming, staying on dogs for a second. Stephen Bramia from Canada is asking, are some types of dogs more susceptible to the virus than others?
Directed at anyone in particular, or is yeah, no, not as far as I am aware when it comes to like geographic differences in dogs. I mean, a dog is a mammal, and all mammals are susceptible to it. Of course, it also the incubation period and everything depends on the bite site. So the closer to the central nervous system the bite site is, the quicker the onset of the disease and the less of a chance to intervene before this. So in that regard, younger dogs are probably, yeah, they can get it quicker. But when it comes to the general susceptibility of it, no, all dogs are equal. But also, just to quickly go back on the education question as well. Absolutely, prevention is better than cure, especially in a disease where there's no cure available. So there is no cure, there is only prevention for rabies. So that's why, for instance, all of our education programs are really targeted at the primary school level, and we managed to actually put these materials in the primary curriculums in Malawi, in Goa. But also to quickly go back to the beginning of that question with regards to accessibility, it's yes, accessibility is there, but it's it's also about the barriers to accessibility, and that is one of the key problems. Yes. So even if you have the education, even if people are informed, can they actually get from A to B? Can they get to a health center that stocks the vaccine? Yeah. So there are countries where you can only get the vaccine despite it being accessible. So it would show as being free to the population. It would be shown as being accessible on paper. But if there are only 3 clinics in the entire country that stock the vaccine, a rural subsistence farmer, how does that farmer get there to actually get the vaccines, depending on which regimen the country of post-exposure prophylaxis that the country then employs as well, multiple times to go and get the shots. That is day off the fields, that is lack of income. That often plays a role as well. People just brush it off sometimes and say like, okay, they do their own cost-benefit analysis and say like, okay, can I actually afford to go to the hospital? And that is a massive issue as well. So yes, even if the vaccine is freely available, it doesn't necessarily mean it gets to where it's needed.
Yeah, structural issues of poverty are inescapable in NTDs, and especially in rabies. So I think that's a very, very fair point. We're being asked by Semu Adeni from Nigeria. I think we kind of answered this, but he's asking, are other domestic animals likely to harbor this virus? What are the possibilities of transmitting it to man? So the kind of zoonotic. I think we've answered that in terms of the raccoons and the different pieces there. So I think we can move to that. Stephen Bram has been back asking a very simple question: how effective is the vaccine?
There are several.
How effective is the vaccination?
Yeah, so all internationally approved vaccines are very, very efficient. So the parenteral vaccine, I mean, there's several studies out there, and everyone has to make up their own mind with regards to which vaccine to use and what they think of which particular brand. But there is a lot of high quality vaccine out there, and that's the quality, the availability of quality vaccine is there, and it's internationally available.
Yeah, and I'm just gonna collapse a couple of questions together actually on that. Dr. Semi's Semi is actually asking, can anything be done to reduce the cost of the vaccines? I mean, that's the million-dollar question, isn't it, really? But
which vaccine are we talking about? I mean, are
yeah.
we talking about dog vaccines? Are we talking about human vaccines? I think dog vaccines are already, if bought on a large scale, are actually quite affordable. Even the high standard ones, yeah, they are within the means of a lot of countries. When it comes to the human vaccines, the Global Alliance for Vaccines and Immunizations, Gavi, recently added human rabies post-exposure prophylaxis to their portfolio as well, which should enable a lot more countries to actually access this. There are some conditions to this, and I think that would go beyond my my understanding of those and the scope of this webinar, but it is more widely available nowadays and more affordable.
Yeah, I mean, Dr. Francis Olaki from Uganda has made this statement in terms of this, and I'm just going to read this out. In my country, Uganda, it costs about $0.2 to vaccinate a pet against rabies, while it's about $10 to treat a human following a dog bite. Given this kind of scenario, so $0.2 to vaccinate the pet, $10 to vaccinate the human, one health approach still is the best control strategy. Professor Waqas, Ahmad, there's a question for you. Are dog ecological studies really relevant in the control of rabies, both in the human and dog and human populations?
Yeah,
how relevant?
The ecological studies are really important in order to design the mass dog vaccination. And the former friend there, he also asked about the vaccination, that how we can save the vaccination. And I think I would like to answer that question, that we can save the vaccination either in humans or in dogs by how we are doing the vaccination. That what are our methods and what are our priorities in performing the vaccination either in humans and dogs. So this is the most important point, that how we are doing the vaccination, we can save the cost of the vaccine and we can also save the biologicals. And in order to understand the dog densities and the population, it is really important for the mass dog vaccination. Like if we do not have the estimates of the dog population in any specific area of a country, then we cannot design the budget assessments, the resources, the amount and number of vaccines used for the vaccination purposes, the administration cost, and all these things need budget assessments, and all these resources need budget and a lot of expenses. So in order to design the mass dog vaccination program, it is really important to understand the ecological studies, that what kind of dog species are being harboring in that specific area, what are the dog niches, and those ecological studies, they are also directly linked to the humans. Like they are freely roaming on the streets and roads, and the human beings, they are also within them, and they are also performing their business. So it is a quite mix of population of animals and humans. So we need to figure out the exact calculations in order to design the effective strategies, not only for rabies, but also for other diseases as well.
Great answer. We've got a question from Paul Ho, 2 questions. So just coming back to disease reservoirs and the transmission kind of pools, are scavenging raptors like vultures ever infected after consuming dead rabid animals? That's the first question. So are scavenging raptors like vultures ever infected after consuming dead rabid animals? And then he's also asking, so I'll put the 2 questions together, is there a health risk from meat from cattle bitten by vampire bats, and which may be incubating rabies virus but still asymptomatic at slaughter? Any cases amongst abattoir workers? So one question on,
I think.
So who would like to go first?
Do you want to go first?
Yeah, I would like to answer. Yeah, it's a really interesting question. that the raw meat is also responsible for the transmission of rabies. There is a very good published report that the consumer, there was a hotel, and the customer, he consumed the raw fox that was not properly cooked. We have different cultures, and we used to eat meat from different animals. So that specific customer consumed the raw fox meat, and that fox was previously was rabid, and the patient, he also got rabies out of that fox. So that meat, if the meat is not properly cooked, and if it is really bitten by a rabid dog, or if it is bitten by a fox, the bat, which is in fact rabid, then the chances of transmission for rabies are 100% for sure. So we usually recommend not to drink either milk, and we shouldn't eat meat from a rabid animals. So this is important. So sorry, what was the first question?
So that the first question, let me just
the vultures. Can vultures get?
The vultures. I'm not yet sure that the vultures can get rabies, but we didn't. I didn't see report that the vultures, but the vultures are indirectly responsible for the transmission of rabies. That there could be dead animals, there could be rabid animals, there could be household waste, and the vultures, they used to pick up those dead meat, that raw meat, and they can fly wherever they are, and they can also transport that meat from one place to another. So it is quite a dynamic source of transmission of rabies. So the vulture itself cannot transmit rabies, but indirectly it is a very good source of transmission of rabies.
Yeah, I mean, as I said before, I mean, animals that are susceptible to rabies are mammals. So with vultures being birds, they can't get the virus. And the same, I mean, when it comes to the consumption of meat, as Dr. Ahmad already highlighted, it's often a problem when it's not properly cooked. That's why, in general, it's discouraged to eat consume animal products from rabid animals. If everything is it's discouraged. Let's leave it at that. let's not do it. So let's not dive into eventualities and scenarios. Just don't eat meat from rabid animals.
From rabid animals, yeah. I think that's a great take-home message there. So two great answers. So Helena Uliartha from Jakarta, part of the Indonesian government, is asking, in fact, many free-roaming stray dogs that cannot be vaccinated because of availability of vaccine, how is the role of the FAO to support the vaccine?
I am not affiliated with the FAO and cannot answer this. However, I mean, there are several ways to go to access that population. One would be similar to what we are doing in India, is to catch these animals and parenterally vaccinate them with the available vaccine, which is the vaccine itself is relatively cost efficient. The catching method itself is quite cost intensive. Another way, but we have a highly effective vaccine that we can give those dogs. So it's kind of like it's a bit of a balance here. Another method would be oral vaccination of these animals. So rabies elimination in Europe was achieved through mass oral vaccination of wild animals, bait traps, so oral baits. There is vaccine available. It's currently not licensed, but it is available, and we've been looking into the opportunity in different countries and the possibility to use that for exactly those inaccessible populations. And the trade-off here is really to distribute this really safe. So this generation of vaccines is really, really safe. To distribute those baits, you really need a very small team. but the vaccine costs are comparably higher to the parenteral vaccine. So it really kind of depends. I mean, if someone would like to have more information, we're more than happy to share all of our experiences in that field as well, and link people with the respective stakeholders in this arena as well. But I wouldn't say these populations of dogs are inaccessible, and those are often the ones that really foster the transmission of rabies as well.
And I'd also like to say that perhaps the question on the FAO would be best answered by the United Against Rabies collaboration, the World Health Organization, OIE, FAO, and the Global Alliance for Rabies Control. They joined forces, as we all know, several years ago. That might be a better place in terms of stakeholders to answer Helena's question. I think that's a fair point. I think just to come through here for 1 second, Stephen Gramia is asking, this is a very interesting question, how do you manage to reach 70% of non-owners, i.e. the non-owned dogs, the free-running population? How do you actually go about, especially in a country like Pakistan, massive geography, large swathes of rural land? How are you going to do that? How are you going to get to the non-owned dogs effectively?
It's the holy grail.
The holy grail, number 2,
I'd say probably a good question. And the MDV programs, the mass dog vaccination program need, like I said earlier, need a very sophisticated programming and budget assessment, and we need a lot of manpower to do that job. So like the Frederick Lohr said, it's really interesting that they vaccinated 37,000 dogs in Mali in 10 days. It's really a very good job. So when I was back in a training in Iran, sponsored by the Pasteur Institute, and where I experienced the GOT device, the Global Alliance for Rabies Control, they have a GPRS device, just like a smart cell phone. They used to capture the dog and vaccinate it, and they press the button, and that device captures the GPRS location of that dog, and then we move on. And like that, we started to vaccinate the free roaming dogs through the capture and vaccination and then release of that dog. So like that, in order to do that, we need a lot of manpower, the transport, the budget, the fuel. So all of this comes in a MDV programs, and we need a sophisticated program like the Mission Rabies. It's really interesting to help to put on board these programs in order to effectively conduct the MDV programs. So without the proper GPRS programs, the coordinated efforts, we cannot do this alone. So then it will be really difficult to achieve the 70% vaccination. Yes, that's it.
So Fred, let me just, when you presented your presentation, Frederick, it really spoke to some of the gaps and barriers addressed by Dr. Ahmad in his presentation. So just coming back to you, what makes your program so successful?
Well,
what's the thing that you're doing?
Well, as Dr. Ahmad said, monitoring of the program is probably number one, and really learning from what you're doing. And that's exactly what we do. I mean, we don't need any extra devices to monitor our program. You can run our app on any smartphone. It runs on Android, on iOS. It's freely available. You don't need to purchase any extra devices or anything, or have a complicated setup. It's fairly straightforward, and especially if you're in the field of disease control. And it's not just for rabies. You can use this for all sorts of diseases. We're working with several governments to currently adapt it for more widespread animal disease surveillance and reporting from the field, because it's almost instantaneous. So depending on the settings and the availability of network service, you can have live feedback from the field. You can see where your teams are, you can see where they have vaccinated, and that's exactly what we do. So how do we get these 70% in those populations where you have a lot of free roaming animals? As I mentioned before, we catch them with nets. We do look into novel methods like oral baiting as well of these dogs. So, and yeah, really just collecting this data, analyzing it on a regular basis, and then really adjusting the programs accordingly is at the core of what we're doing. We've published several papers now in renowned journals from PLOS NTD over Lancet to just share the results of our work and share the way we do work. So in PLOS 1 2 years ago, we also published about our application. I can share that link in the second here as well, if that is required or wanted. So
well,
yeah,
I'm sure it is, Frederick, because we're getting a lot of feedback from some of the some great feedback. So Caesar Gavidia, great presentations. Thank you for sharing your experiences and ideas. Caesar's also asking if he could get a recording of today's webinar, which we'll be sending out to everybody in any case. And if you want to access that, all you have to do is subscribe to our YouTube channel, and you get all the automated updates. You know, they'll come straight through. Francis Inglet Olaki from Uganda. This has been a very enriching talk. I must confess, I have learnt a lot of new scientific principles when it comes to control of rabies in both human and pet populations. We've got one clarification to make, which is Paul Ho. He asked about pictures, and he asked about the vampire, he's saying, I wasn't advocating consumption of rabid animals per se, but the cattle question relates to bites in cattle from bats that may not be detected, and rabies virus contaminated meat then entering the food chain. So he's kind of talking about he just qualified that, the non-detected cases there in animals. I mean, I'm being sorry. Yeah.
Yeah. No, I was just saying I'm not aware of any studies with regards to rabies in abattoir workers in Latin America, but this is probably the most pertinent problem. I'm not aware of studies, but bat rabies is not my field of specialty. However, as both Dr. Ahmad and I stressed as well, technically, if the meat is fully cooked, there should, and I stress there should not be a problem. I'm very careful saying this on record.
Yeah,
so that's why I was like,
define cooked.
Yeah, exactly. So I'm not sure. The answer is I am not sure. I'm not a bat expert. But perhaps the US CDC, they might have some data on that, because I know they've been coordinating a lot of efforts in the region.
I would like to add that the bite of bats, it's really important that we cannot detect the bite, but we can establish the differential diagnosis. You know, like if the bat bites the cattle or the large animal, and then we need to consult first with the veterinarian, because when the animal comes in heat, they also used to exhibit the symptoms which are just like the symptoms of rabies, but the animal is not actually rabid. That is some sort of different thing. And if you are looking at the animal and the animal, the cow or buffalo, they are exhibiting the symptoms of estrus or heat cycle, then those are different. So you have to differentially diagnose. There are also circling disease, the other encephalitis diseases, which are being very important in ruminants. So there could be other disease. So you have to establish the differential diagnosis and the diagnostic test in order to screen the difference between whether it is a rabid animal or not. So yes, that bite of that bat is important to discuss, but it is also really important to establish the differential diagnosis and to monitor the signs and symptoms in large animals.
Brilliant. So If it's okay, then we're going to have one last question because we're actually half an hour over, and I appreciate you staying on. But you've been very popular presentations and very well received. With a lot of questions coming through from the audience, a very engaged audience. So we thank you all for that, to the audience and to the two presenters. There's a question from Professor Majid Harandi from Iran. He's asking, what is the major difference in the strategies for rabies control in owned and unowned free-roaming dogs? What's the major difference? That's a big question.
Yeah, that is.
It's a huge question.
Yes, I would like to, Dr. Frederick, to please answer this. It's an interesting question. I would like to know his opinions.
Fair enough. So again, this circles back to the point that Dr. Ahmad stressed as well with the dog population surveys and studies. So you do need to know what your population looks like on the ground. In this case, was it owned and unowned free roaming population? Is with a stress on free roaming, or just owned versus free roaming? So okay, that highlights also all the difficulties that are around this. So in general, you have to look at the dog population in different strands. So you have the true free roaming, the stray dogs. They don't have an owner, they roam the communities, and they don't have anyone who usually handles that dog. Then you have the owned free roaming dogs, which do have an identifiable owner. They are at certain points in time free roaming, or all the time free roaming. And then you have the owned dogs that are inside or with the owner at all times. Now, to access all of these different dogs, all of these different populations, there are different strategies. So for the owned free roaming dogs, there are countries. So for instance, there's several types. In a lot of sub-Saharan African countries, for instance, most dogs have an identifiable owner. So we know this dog belongs to person A. Now, the virus often circulates in those communities because these dogs, especially at night, are let loose. So they are off the chain. They are running around the community. They behave like free roaming dogs. However, during the day, they're often on a leash. They come back home because that's where the food is, and the owners can handle that dog. For this sort of population, static point vaccination is really the key. So in the static point vaccination scenario, which we use most African countries that we work in, for instance, you set up a static point vaccination clinic at a certain point in time in the community. You advertise this. So for instance, we use our education program as well to advertise this in schools. And then the owners bring the dogs to these points. In a lot of these scenarios, that's actually the kids. The kids often handle the dogs. The kids then bring the dog owner over, and then you can quickly vaccinate the dog when it's brought to the clinic. These other scenarios with the free roaming dog population, it really depends. So if the dog has an identifiable owner and the dog is used to being handled by this owner, then you can often, in the way you announce the program, when the program is going to be there, these dogs are accessible, and you can do a door-to-door vaccination. So basically, you have a team that goes through a street. They either announce from the vehicle that they're there, or you literally go and knock on every single door, and then the dogs are being brought to you. You vaccinate them, and then they're being let loose again, and they run around. And then for the own free roaming dogs and the truly stray dogs that are not accessible through that door-to-door method, you would need to employ either catching. So if they're easy, if they're accessible, often in populated areas, urban areas, it's okay. But then you have these dogs that constantly run away because they get to know the teams, they know what's coming. I mean, you have to repeat this over multiple years because you want to be as close as possible to your 70% vaccination coverage in your local dog population. And you have then these pockets of the dogs that always run away that you can never really catch. And in those cases, that's when oral vaccination comes in. basically. So at the moment, we don't have a way. If we can't catch them, if we can't hold them, we currently can't. There's no way of vaccinating them, and darting them is not really a thing as well. So discourage that, if that, just in case that comes up as the next question.
Darting,
So oral bait is really the way forward in those cases. And that's why there are a lot of trials set up across the world at the moment to get the right procedure, because and that's where the dogs start to differ. Like people, dogs have different tastes. So these baits need to be comprised of materials that the local dog population A likes, and B that are also culturally accepted in that setting. So that's why you have to have these bait trials in advance as well. The vaccine needs to be licensed, and again, these newer vaccines, they're all very safe. But so basically, those are your 3/4 main methods that you have: static point vaccination, catch, vaccinate, release, door to door, and then oral bait. And again, just to stress the importance of surveying your dog population. If you don't know your dog population, you don't know to which percentage and which combination you actually need to employ these methods. And in every place, we basically fine-tune our approach to the local dog population, and through the application that we're employing, we also do get that feedback straight from the field. So when a dog is being vaccinated, the teams also record basic demographic information as well. All of these forms that we're using are highly customizable, so they can be changed to every setting. They can be displayed in the local language and local script. So it's a very flexible application, and you get that data straight back, and then you can adjust your program accordingly. So the most difficult part about rabies control is to get started. And I always call rabies the neglected of the neglected tropical diseases, because it often, because it's such a daunting task. It's like, that's exactly it. How do I access these dogs? How do I get them vaccinated? Ooh, I don't know. That's why I don't do it. But when we get started, we get that data in, then it becomes a lot clearer, a lot better to understand for all the stakeholders, and transparent as well. I mean, when that data comes back, you see exactly what's happened in the field.
And I'm just extrapolating on what you're saying. There has to be a policy trigger at the government level, at the political class, to engage and release budgets and this kind of thing. I'm just wondering if your app, with the pooled data that it's generating, the app combined with the asset of the actual community. You saw the primary schools and the way they were reacting to your Mission Rabies approach in the video. And I'm pretty certain if in places like Pakistan, if they could engage through that or an app, having that kind of ticked off and having that data being generated would enable some kind of real policy trigger to be pulled. Because it just appears that the political class are not listening. It's kind of over their heads. So there is a question there, and that is what kind of socio-economic case building do you have to do, Dr. Waqas, Ahmad, to the political class for them to engage with money? Because you need money to do this. So what's the trigger?
No, I'm curious.
Yeah. From your opinion,
that is the trigger. That is some sort of tricky and difficult question to answer. That what could be the trigger to get on board? I think the evidence-based facts could be the trigger. Like we have started the pilot project in Karachi with the donation of 50,000 vaccination vials from the vaccine bank, and then the director, Dr. Naseem Salahuddin, she just presented some of the child suffering from rabies to the mayor of Karachi to show him that look at the situation, this is going to happen if you are not going to fund. This is going to happen if you are not going to advocate your program, and if you are not support of a cause. This is going to happen. So that is some sort of also emotional manipulation, I can say, or the trigger. We can start with that politicians, and We also need to show them the evidence, the stats, the deaths, the culling of dogs, just to let them know that this is not good practice. This could also cause some other problems. The bacterial infections, the attraction of other animals, and the source of decontamination, and the contaminating source of other animals, and the problem in the transportation, the hygienic environment. So a lot of factors, if we just show them in a very simple language, they can understand the facts, but they need to have a very bothering, like they need to have a very, like you can say that, a very bothering facts, the negative facts. If they see that the true negative picture of their disease, if we represent a very big picture in a very short word, then they can understand the facts, and they can jump into this situation.
Yeah, and certainly the communication challenges around advocacy, sustained advocacy, are very, very important. One should never underestimate the power of advocacy, and especially in this in this setting. And you said this is, as Frederick had put it, the most neglected of the neglected tropical diseases. So it'd be interesting to see how all of this evolves in the next, in this decade, on the 2030.
Sorry to interrupt. The problem is the COVID-19 as well. The rabies is neglected disease, but the COVID has made it more neglect. So it is also already neglected. So so the COVID-19 has slowed down the progress, has slowed down the focus of disease. So this is also a factor for me.
Yeah, I think with the COVID, there's a very interesting silver lining, and we were discussing this at our United Nations General Assembly webinar 2 or 3 days ago for dengue. So, and that was that the COVIDization of the world population. Essentially, what's happened is the lay public have now, everyone's a public health expert. Everyone is now involved, engaging their mind, engaging their, and they're compliant to wash, to washing hands, to their space, social distancing. They become more compliant and they become more aware. So in one way,
the funding is also directed towards COVID-19. This is also another factor.
Yeah. The funding. I'm just saying that COVIDization may well just push large swathes of the population into these Mission Rabies type of engagement programs, where they can then generate the data ultimately needed to present evidence-based, going into evidence-based policy at government level. So this could be a very interesting turning point, frankly. A lot more people are aware. I'm being told that we're going to have to call it a day. They've been pressing the red button. If I could turn my computer around and show you what I have to face. I'm not going to do that. But I'm being told in no mean terms it's I have to. So I'd just like to say thank you very, very much for a very informative, very robust, and very engaging webinar. Very fitting that it's on World Rabies Day, and I'm assuming both of you are open to people emailing you.
Oh yeah,
yes.
If
we have shared our emails,
because I've got some people asking, can we get in touch with both of you? So we'll do what we can do. That's fine.
Our email addresses are fairly straightforward. fred@missionrabies.com. So
there you go.
If you remember my name, you can email me.
Okay, brilliant. And I will, Dr. Ahmad, I've got yours. I will definitely send this email around to everybody, and we're going to make the recording of this available in the next few hours. If you want to use this as any part of your advocacy to your own students at the university, nationally, anywhere, it's there to be used. Okay, it's there to be used. We will definitely be putting it across social media. So thank you very, very much, guys. And a round of applause.
Thank you.
Thank you.
And have a wonderful day. All right, and we'll keep in touch regarding the evolution of this.
Oh, absolutely. Okay? Yeah, we already said we're gonna Skype later this week. So
good, brilliant. Guys, for me, awesome. Adios. Salam.
Alrighty.
Take care. Bye-bye. Bye.
Alrighty. Bye-bye.
Okay, thank you. Bye-bye.